All right, ladies, thank you very much. I like that New Year, New You. Well, you know what? Many of us race around town to see multiple doctors to get top-notch care, but at what cost when it comes to our time, our money, and our quality of care? Imagine getting the care you need for multiple issues all under one roof. This is the core concept for Cornerstone Integrated Healthcare. When your patients walk into the room, into the building, what can they be treated to?
They're gonna be able to be treated for whatever they have. That's kind of the cool thing. We focus on what's called physical medicine. That's going to be more of maybe shoulder, back, neck. But we do a lot of allergy work, bioidentical hormone type replacement, headache treatments. Those are just a couple of the things that we do in addition that we specialize in.
Do you realize just how much time and energy and effort you're saving your patients from having to go all around town, you know, to Kansas City, to Johnson County and back, just to get a little bit of relief?
Absolutely, and that's what I think patients love is not only is it just one stop, but we're doing a rehab, so they may have some structural work, so they may do their rehab, but then they'll also see maybe our physician assistant, maybe they have an injection of some sort. But then after that, maybe they finish and they go see our chiropractor and they get an adjustment. All that, one place, one appointment, and one copay. So those are all the things that kind of make life nice for our patients. Light bulbs go off, when I see eyes get big, they're like, wow, you mean I can do all that here? And that's kind of what we love. So one of the things that's different about our clinic is in every treating area, you will see a high-tech computer system in there and with detailed information about each patient. So if they see our physician assistant, the physician assistant's going to have access to all their notes, x-rays, they're going to enter their information, and then by the time they go maybe see the rehab staff, that's all going to be up to date. And so all of that follows the patients, so for efficient treatment. This is some of the technology that we're able to utilize that just really make this stuff easy, not only for us, but from a patient perspective as well, so that they can see what's going on. And we always try to make sure that before we ever do any type of treatment with a patient, that they understand what we're doing, they understand what the goal is as well, and together we work towards that. They can expect it. The first exam, most of my patients leave saying that was the most thorough exam I've ever had in my entire life, because we are going to make sure that we understand everything from an internal perspective to a structural external perspective. So they typically will meet with one of my case managers, and that is a trained staff member whose job is to walk them through this process. Sometimes when you see multiple doctors, it gets kind of confusing and scary. So that person's job is to hold their hand through the process. The next step would be then to meet with maybe our nurse practitioner or our medical doctor, where they would do a thorough physical exam, or make sure there's nothing major that we're missing with the patient. And from that point, it kind of depends on what their desire is. If it's what I would consider a physical medicine patient, maybe it's a shoulder or back, then they may meet with either some of our rehab staff or maybe our doctor of chiropractic for the rest of the evaluation there. And then any sort of testing would be finished, done that day, the patient would leave, and then we as a team get together that very next morning, and we spend a large part of our day studying the information as a team. And then we put together a plan of attack as a group, taking the best of the medical, the best of the structural, the best of the rehab. We put it all together so that we'll hopefully get all the positives and none of the negatives.
And one of the key services that Cornerstone Integrated Healthcare offers is a new FDA-approved migraine treatment. They're the only medical facility in our area. We'll talk about that in a little bit, but first, Dr. Sean joins us now in studio with more on. Good morning, first of all. I'm smiling, and just like all your patients who walk out of there have been smiling, because you treat a number of conditions under one roof. Talk to us about some of those conditions, Dr. Sean.
Yeah, the conditions we primarily treat are physical medicine conditions, and for a lot of my patients, I know that they don't necessarily know what physical medicine is. So physical medicine is just trying to use more of a natural approach towards healing or health. That doesn't mean we don't use medicine, doesn't mean we don't do injections. However, we're looking at the long-term benefits of care. What that means is, let's say you have a car and the axle is bent, right? Sooner or later, those wheels are going to break down, they're going to wear out. If we don't really address the axle, and we just keep replacing the wheels, that would be similar to what we do a lot of times with our medical approach. So we're not against that, but we want to put everything together so it works in harmony.
I like the fact that you're focusing on not just treatment but prevention as well, and you know, looking at the body when it comes to a knee or a joint, if it breaks down, your body is trying to signal a problem, and that's where your superb team comes into play.
Yeah, you know, one of the things I think is amazing is that, and maybe it's just me because I deal with it every day,
right?
But that people think that pain is normal. So the reality is pain's not normal. And
but we're told that like, growing up, you know what, like even the Marine Corps motto is pain is weakness leaving the body.
That's right. If
So
you're not
like
crying, we're not trying. That's
there you
how it
go,
goes.
Dr. Sean.
Yeah.
But how do you break us out of that? I mean, when should people turn to you and your staff?
Well, understanding that pain isn't normal is really the first step, and understanding what our body's trying to communicate. So, for example, if we touch a hot stove, right, the body gives us a signal to let us know there's a problem. What is that? Pain, right? Doesn't feel good.
No.
The body's not doing it just to be ornery, though, right?
It really hurts.
It hurts, right? And the reason for that is it's saying, "Hey, knucklehead, move your finger," right? And so hopefully we would take that advice. However, if we have chronic pain or chronic conditions and we just leave our body in that state and we don't do something about it, then eventually it starts to continue to break down. And so, for example, headaches, you know, and I think we're going to talk about that.
Oh, you are walking up my alley because, you know, it seems like a lot of us try to play a doctor. You know, we see the commercials, we know what we need, but we are confusing the different types of headaches. So why don't we first talk about the different types of headaches when it comes to migraines?
Sure. There are very different types of headaches, and the type of headache it really dictates the type of treatment that's going to be effective. Unfortunately, I see kind of a one-stop shops out there where they do the same approach for everybody. It doesn't work.
It's all about where that pain is, correct?
Exactly. So there are really two of the main types that we see, and there are lots of little subdivisions in there. But the primary type are tension type headaches, which are going to follow typically the occipital nerve. It's going to deal with some neck stiffness and tightening. And what happens is it kind of squeezes the base of the neck, squeezes the nerve that comes this way to maybe even above the eye. And that would be more of a tension or cervicogenic type headache.
Is that where a lot of your clients that do kind of clerical work or at a desk all day long? Those are more tension headaches. Real quickly though, what's a migraine then?
A migraine is a different type of a headache altogether, and I can't even say that we clearly understand it. The research is mixed. However, we do know the nerve that's involved, and we do now have a way to get to that nerve and turn that migraine off.
Yeah, this is an FDA-approved approach, and we're so excited that we have a new partnership with you. And so throughout our segments, you're going to bring another expert on. Could be you, could be another doctor. But we're going to talk about how this is instant relief.
It is, yes.
You know, I thought I had migraines. Maybe I just have all that and then some. But I now know where to go, as our Better Kansas City viewers do too. Dr. Sean, thanks for joining us.
Oh, it's my pleasure. Appreciate
you. And you know what? You can find Dr. Sean and his team at Cornerstone Integrated Healthcare on 95th Street in Overland Park. To make an appointment, call 913-492-2225. That number's on your screen. Or you can go online to www.cornerstoneintegratedhealthcare.com. Up next,